Good morning, all. Today we will be dealing with pediatric cardiac arrest and the algorithm of BLS for pediatrics. The cardiac arrest can occur to any patient, that is, even for the adults or for the infants or for the children. In the last classes, we have seen about how to give BLS for an adult patient if they seems to be unresponsive or found without any pulse. Today we can see in detail how we can manage the same situation in pediatrics. It is rescuer. If there is only one rescuer, what all things you can do? If you are alone with the child at the scene, that is at that circumstances, what all things you can see? That is, you know that there are two types. That is, if there is can provide one rescuer, or else we can have two rescuer. One means only one person is there to help the patient get recover from the situation. That is, if you people have found one child lying unresponsive, then what are things you have to do when you are alone? The first and foremost step that you have to do is tap and talk loudly to the child to determine if they are responsive. What we have to do, we have to tap the patient, and also or else we have to call the patient or speak loudly to know whether the patient is responding to your talk. That is the first step. Next, we have to check for breathing. And while checking the breathing, along with that, we have to check the child's pulse also. In adults also, we'll be doing the same thing. For children, we can check the pulse either in the carotid region, that is on the other side of the neck, or else on the femoral pulse. The femoral pulse can be palpated in an area between the leg as well in the groin, that is in the fold or in the crease. You can palpate the femoral pulse. You have to check the pulse for 5 seconds, but not more than 10 seconds. Within that small time, small seconds, you have to do all these things. That is, the first step is you have to tap and call the patient and check whether they are responding. Next is you have to check the breathing and also the pulse. If the child does not respond and is not breathing, that is, the child is found in a gasping state, we have to call for help. If someone answers, then send them to call 911 or the emergency services to get the AED, that is the automated external defibrillator. Is it clear? You have to, after checking this, that you have to say, you notice that the child is not responding and also not breathing, but if you need extra help, you can call the emergency team. Next is feel for the child's carotid pulse on the one side of the neck or the femoral pulse. Know that whether any pulse has been recovered. If not, if you cannot feel any pulse or it is not feeble, the pulse is very feeble, cannot palpate it, then you have to start doing CPR. That is the CPR. Here it is the difference. By providing the CPR, we have to do 15 compressions. After these 15 compressions, you have to give 2 breaths for the patient. If you can feel a pulse, but the pulse rate is less than 60 beats per minute, you should begin CPR. This pulse rate is too low for the child. Compared to the adults, the pediatric or the child pulse rate will be more. That is more than 80, 100, up to 120. The pulse rate can be found. Is it clear? I hope it is clear for you people. That is, if you cannot feel a pulse or you are unsure that the pulse is being palpable properly, you have to start providing CPR. In providing the CPR, you have to give 15 compressions first. After providing 15 compressions, you have to give the 2 breaths. Then this cycle has to be repeated. The CPR, so that is difference in providing CPR, the rate of compression, the rate of compression, depth of providing the compressions, there is slight difference in the child as well as in the infant. We can see that for the child you have to push about 2 inches deep, whereas for the infant you have to push about only 1.5 inches deep. And also another thing is that you have to provide fast compression, so you have to push fast, and at least 10 compressions or 150 compressions per minute have to be provided for a child case. It's clear for the infant and the child. For the child, you have to push about 2 inches deep the compressions, or with our hand we have to, the rate of providing compression should be 100, and the depth should be 2 inches for the child, whereas for the infant it is only 1.5 inches. And also before providing the compressions, you have to make sure that the child or the infant is lying on a firm flat surface. Okay, you have to make sure that they are lying. If they are lying in some other areas, you have to place the patient in a flat surface and place the patient in a supine position, and then start providing these compressions and breath. Okay, in this picture, it is very clear that how to provide the chest compressions. You know the technique, and already you have learned how you have to hold your hands, your fingers, as well as how you have to stand on them. Yeah, first of all, you have to place the patient or the child in a flat surface. Afterwards, you have to stand like this, with your knees flexed to the patient's bed, and how you have to hold your arms. That is, place the heel of one hand on the lower part of the center of the chest and the heel on the other hand on top, so they overlap. How you have to do? One hand should be placed on the lower part. Above that hand, you have to place your other hand, and the fingers should be interlaced or overlapped. Then you have to lock your elbows. With this, afterwards you have to make sure that your arms are at 90 degrees from the victim's chest. That your arms are not your arms are straight. That is, they are at 90 degrees from the victim's chest. For a very small child, you can give these compressions by placing one hand technique. Okay. For some, for a child above 5-7 years and old, you have to provide. You can practice doing with your two hands like that of the adults. Whereas for a very small child, you have to use only your one hand. Whereas for the infants and for the babies or the neonates, we are providing the CPR by using your two fingers. That is the index finger and the middle finger. In this picture, it is very evident how you have to practice this. And how you have to give two rescue breaths. How you can give the breaths. That is, first you have to tilt the head back and lift the chin up.